Thank you to the Moving the Needle corporate sponsors, Home Infusion Options and Metro Infusion Center, and our exhibitors, Takeda, Janssen, and Bristol-Myers Squibb. You share our mission of advancing patient care and make events like this and our grant making possible.
So our next speaker is Dr. Benjamin McDonald. And Dr. McDonald is one of our fellows. He's in a special track at the University of Chicago called the Physician Scientist Development Track or Training Program. That program is now actually directed by one of our GI faculty who you're going to hear from tonight, Dr. Sonia Kupfer. And Dr. McDonald has his PhD in immunology and is working very specifically on a unique problem related to Crohn's disease. And he's going to teach you a little bit about that. Ben?
Good evening, and thank you for having me. I'd like to talk today about a specific type of Crohn's disease called perianal Crohn's disease. This is a very common type of Crohn's disease. It impacts about 25% of all Crohn's patients. And it refers to the presence of these tunnels or fistulas, which you can see on the right side of the screen. Patients can get infections or abscesses along these fistulas, and they can get narrowing or stricturing of the anal canal. And based on that description, I think you wouldn't be surprised to hear that patients can be very symptomatic, and this can cause a major decrease in their quality of life from the disease. Having perianal Crohn's disease puts you at higher risk of needing surgery and requiring more surgery. Patients tend to have are more likely to have anxiety or depression. And unfortunately, the therapies that we currently have to offer are all too often ineffective, and patients require really major surgical intervention to regain quality of life. There's already good evidence in other types of Crohn's disease that early identification and treatment of inflammation can prevent a lot of the downstream consequences from happening. And we hypothesize that a similar approach may be helpful in perianal disease. Work from other groups in Asia has shown that there is a precursor to perianal disease that can be seen on MRI imaging when a patient doesn't have any symptoms, what we've called subclinical perianal disease. And we think that, building off of what Dr. Cleveland has talked about, using ultrasound may be a suitable way for identifying these patients so that we can know who is at risk of developing complications from the disease. And so the work that the GI Research Foundation was very kind to fund is aimed at identifying how many of our patients here in a very diverse urban population have this subclinical disease, how likely patients with subclinical disease are to go on to develop clinical symptoms, and whether therapies that are currently available can change the course of these patients, whether they can prevent patients with subclinical disease from ever going on to develop clinical disease. And the way that we would like to identify these patients is with ultrasound, because it is a fast, convenient way of screening patients. At least that's the idea, but nobody has ever tried. And already we've been very excited to see that we can identify with ultrasound patients that have subclinical disease. So this is a representative example of an ultrasound image that we took in clinic a few weeks ago of a patient that has no symptoms of perianal Crohn's, but has a fistula tract. So I'll just orient you a little bit. In the center, the target is the anal canal itself. There's a black ring around it. That's one of the anal sphincters, the internal anal sphincter, and a white ring on the outside of that. That's the external anal sphincter. And the arrow is pointing to a small hole, a fistula tract in the external anal sphincter of this patient. We're really excited to see where we can take this, and I thank you so much for the opportunity to do this work.